Will insurance cover your breast reduction and lift? This is a bit of a complicated answer, but in general, if you meet their criteria, yes. So first of all, I just want to clarify that all breast reductions come with a lift. So you will get a lift with a breast reduction. You don't have to pay extra, you don't have to do anything extra. It's part of your breast reduction. So first of all, there's two types of breast reductions. Type number one is you're a cancer patient and you're having cancer treatment and you get a reduction at the same time. Oncoplastic reduction is what we call this. That type of reduction is essentially always covered, even if it's a small reduction. So if that's you, then yes, it should absolutely be covered. Second type of patient is just a run-of-the-mill breast reduction to make your breasts smaller. That can be more complicated. So step number one, if you're someone with large breasts and you would like to look into getting your insurance to cover this, you need to figure out whether your plan covers this. So I think every plan should cover it, but unfortunately, some insurance plans have breast reduction as an exclusion, which means that no matter what, they do not cover this procedure. Now, the next thing you need to determine is, can you meet your insurance company's criteria? And it's essentially the same with every insurance company that covers this procedure. You have to take enough tissue off to meet their criteria. And they'll have this chart called the Schnur scale. They take your height and your weight and put it into a formula which gives you your body surface area. And then next to that body surface area is a weight. The weight will be different depending on your body surface area. So people with a small body surface area will have a much smaller requirement than someone with a large body surface area. Now, I've done videos about this before, but this is not a good method. Dr. Schnur himself does not want his research to be used in this way. The American Society of Plastic Surgery has a statement that this is not good, but unfortunately, this is the world we live in with insurers, and this is what they follow. If your surgeon can meet that amount, and that amount is for each breast. So if it says 500, you have to take 500 off of each side. And just for reference, a soda can is $3.55. So if you can meet whatever they want on each breast, then your surgery should be covered. Now, sometimes they want other things. They want a doctor other than the plastic surgeon to say, hey, I think this patient needs this. Sometimes they want you to prove you've done physical therapy. Sometimes they want you to have other complications from your large breast, like rashes or infections. I have found, I do lots of breast reductions. I have not had an insurance company need any of that for a very long time. As a patient, if you see physical therapy, if you see a chiropractor, I don't like them, but I will take their notes to help my patients. Bring all that to your consult and you could submit that with your pre-authorization, but I don't find that I really need any of that. It's just purely a numbers game. You have to meet their criteria. Now, I will add that some insurers have a BMI cutoff. So I don't like this. I've done posts about research that shows that breast reductions can be done with low risk to patients, even with larger BMIs, and have great benefit. Insurance companies don't think that way, and many of them have a BMI cutoff. So that's important to consider as well. So if you meet their criteria, you submit all this information. We as surgeons, we have to write notes in a specific way and say kind of stupid things that are obvious, just they require it. And if you meet all these criteria, then your reduction should be covered. So what does that mean? Does that mean that it'll be free? No, it doesn't mean it'll be free. So it really depends on your particular insurance plan. So there's different types of insurance plans. And depending on your plan, you will likely be responsible for some of the cost. So you will be, if you have a deductible, you have to pay at least your deductible. So if your deductible is $5,000, you will have to pay at least that. If you have a co-insurance, then you might even pay more than that. And you could potentially pay less than that, depending on your insurance. Now, it also depends on who you see as your doctor. So some of us are more expensive than others. Some are in-network, and that will typically be the least expensive reduction for you as a patient. An out-of-network provider like myself will be more expensive. But all of that will play into what you as the patient will pay for your surgery, even if it's covered. Now, you can see surgeons who do not take insurance. They don't work with insurance at all. They're not an out-of-network provider like me. They're not an in-network provider. You can take your information from that surgeon. If you find someone you really like, you can see them and submit it to your insurance company, and you might get some money back. I find that this is difficult as a patient. It is hard to navigate the insurance world even when I have a team of insurance people, but you certainly can do that. If you fall in love with a surgeon, you're like, this is my surgeon, and they don't take or work with insurance, they will usually give you your op note and codes, and you can apply yourself to get reimbursement. And then finally, I'll just say that I always have people in my comments that are like, just have your surgeon lie for you. It is not good to have a surgeon that's willing to lie. I will just say that. It can affect that surgeon's ability to practice, that surgeon's ability to have board certifications, that surgeon's ability to work with insurance companies. This is not a good path to go down. How you do one thing is how you do all. If you're unethical in one area, you're probably unethical in more. You don't want a surgeon that lies. That being said, I wish every patient that wants a breast reduction can have one. It's such an amazing, life-changing procedure. It's one of my absolute favorites. It is so fantastic. If you are considering it, definitely go in for a consult and learn more because it's incredible.